Good afternoon and welcome to Facebook Live with Holy Cross Health. My name is Nancy Nagel, RN, Vice President of Women and Children's Services at Holy Cross Hospital. Before we begin, I'd like to call to your attention a few ground rules that you'll see in the comments section. We encourage you to participate, but please keep any questions and comments general. We will not be discussing anyone's specific health situation in this public forum. If we cannot get to every question today, we will provide additional feedback through Holy Cross Health's blog, or we can connect with you one-on-one through our program channels, either by phone or website. For those of you joining us today on Facebook, we thank you for being here and for taking an active role in your health and the health of your baby. And we at Holy Cross are happy to be your partner in your health journey. In 2020, 1 in 10 babies was born too early in the United States. While there are risk factors that can increase the chances of preterm birth, including substance abuse or medical conditions, a woman can still have a premature birth, even if she has no known risk factors. Today, we are here with Dr. Janelle Hino, Chief of Neonatology at Holy Cross Hospital, and Dr. Chris Gatages, or Dr. G, a neonatologist at both Holy Cross Hospital and Holy Cross Germantown Hospital. Dr. Hino, let's start with you today. What are some of the reasons that may require a baby to be admitted to the neonatal intensive care unit?
Well, there are many reasons that newborns might find themselves in our NICU, but the majority of our patients are premature.
And by premature, how would you define that by gestational age?
Well, a full-term pregnancy is defined as 37 to 34 weeks of pregnancy. That's the gestational age, 37 to 40 weeks. If you're born before 37 weeks, you're considered premature, although not all premature babies need to come to our NICU. Babies who are born 35, 36 weeks of gestation, we try and keep those babies with their mom. As long as they can eat and their temperatures are stable, we keep them with the mom on our mother-baby unit. But if you're born below 35 weeks, if you're born at 34 weeks or below, that's an automatic admission to our NICU.
And Dr. G, I had this question asked recently by a mother who shared that she had been in the hospital this week because she was having contractions at 33 weeks and was 2 centimeters dilated. Her question was, what would the chances of her not having a preterm baby?
That's a great question, Nancy, but I would advise this mother to discuss with her OB. That is a question for her OB doctor. However, we have seen plenty of women that start to dilate prematurely, but don't necessarily have a baby early. So it's important for all moms to be very closely in touch with their OB and make sure that their OBs know if they're having any problems.
And are all premature babies required to spend time in the neonatal intensive care unit?
Not necessarily. If they're born over 35 weeks, they're still premature. 35 to 37 weeks, we call them late preterms. And even though they're premature, they may be able to stay with mom. We watch them a little bit more closely than full-term babies. We watch their temperature, we watch their feeding ability, we watch how they're bonding with their mom. And if they're having any trouble, any breathing, temperature, feeding trouble, we transition them to the NICU. But otherwise, they may stay with mom and go home with mom.
And are there common health problems that premature babies can have after birth?
Premature babies will have some problems depending on their gestational age. The younger the gestation, the more problems we anticipate to see, more importantly, breathing problems and feeding problems, as well as maintaining a normal temperature.
And back to Dr. Hino, speaking about our program, what services are available for babies that are born with complex medical problems?
Well, for us, we are a level 3 neonatal intensive care unit. We do offer a very high level of intensive care medicine. And the lower the gestation, like Dr. G said, the more problems and the higher the intensity of the services are required. So here at Holy Cross, we have really a unit within a unit. We have a tiny baby program that uses certain protocols that help us take care of the smallest of our patients. So the smallest of our patients, because their lungs aren't developed properly, will need help breathing. They'll have to be on special machines called ventilators. They'll have to have special types of feeding. We have ancillary services that help with feeding, with nutrition, with the respiratory problems. So in the NICU, it is really a team approach that takes care of these babies.
And is there an earliest gestational age for survival?
Well, that's a great question. At different units, they have different protocols. And here at Holy Cross, we attempt what we call resuscitation for babies as low as 22 weeks gestation. So we come and talk to parents when the babies, if you are threatening to deliver at 22 weeks, we come and talk about what that might entail for you and your family. We discuss at 23 weeks, we discuss at 24 weeks. So the earliest babies that we will attempt to bring into our NICU starts at about 22 weeks.
What is the gestational age of the smallest baby treated at Holy Cross Hospital?
22 weeks.
And then the difference between a level 3 NICU and a level 2 special care nursery, what is that?
Well, here at Holy Cross in Silver Spring, we have a level 3 NICU. So that means that we can take care of the smallest, the sickest patients. A level 2 NICU is a NICU that has care of babies that are at 32 weeks gestation and above, and babies have to have a certain weight. And here in neonatology, we use grams. So at 1,500 grams, and over 32 weeks, they are allowed to stay in a level 2 NICU, and if they are under that, then they are transferred to a level 3 NICU.
Thank you, Dr. Hino. And Dr. G, if a baby born at Holy Cross Germantown Hospital needs more intensive care, how would the baby be transferred to Holy Cross Hospital?
Nancy, that's a great question, and it's good for our community to know this. We work really closely with our sister hospital at Germantown. A lot of us cover the same hospital, the same staff go back and forth. So if a baby is born before 32 weeks at Germantown, the special care nursery is fully equipped to take care of that baby for the first several hours of life. They will stabilize, they will take care of the needs of the baby. They have ventilators that they can use to provide care to even the smallest babies. In the meanwhile, a team is mobilized from Silver Spring Hospital to go over on ambulance, pick up the baby, make sure the baby's stable, discuss with the parents, and bring the baby over to our higher level of care NICU in Silver Spring.
So all the equipment you need is right on that transport vehicle.
Absolutely, and this is a fairly new program. We've had it for the last few years, and it's been working beautifully. We bring the babies here to Silver Spring until they're a little bit older, and once they reach approximately 32 weeks, if the parents wish to go back to where they started, back to Germantown, we transfer them again on ambulance with a specialized team back to the special care nursery in Germantown Hospital.
I'm so glad that you raised that, because that's a question oftentimes that we get. You know, if my baby was born at Holy Cross Hospital, but I live close to Holy Cross Germantown Hospital, once the baby is stable, the baby can be transferred back out closer to the parents.
Absolutely. We want to make sure that we do the best for the family. If a family is close to Germantown and they're able to visit their baby there, but it's a hardship for them to come all the way to Silver Spring, we absolutely will do our best to transfer the baby. And also, if a mom delivers in this hospital in Silver Spring and the baby is cared for in our NICU at Silver Spring, if the family lives closer to Germantown, they can absolutely request to be transferred, and we have case managers. They will discuss with insurance, and insurance will generally approve it, and the baby can be transferred to Germantown.
Thank you. And Dr. Hino, how does Holy Cross support parents when the baby does require an extended NICU stay?
We pride ourselves in our support of our families here. Families sometimes come into our NICU and they stay for a couple of days. Sometimes babies are admitted and they stay for several months. So we have programs in place that support families. We have social workers. We have a fund that we have through the foundation that helps families in need. This is a fabulous fund that we have. It's called the Ryan Donald Basile Memorial Fund for NICU Families in Need. A long term, and it describes this fund beautifully. We just had our 1-year anniversary of this fund. This fund was put into place when one of our nurse practitioners, Susan Basile, who has been a member of our NICU family for over 30 years, taking care of families and their babies, tragically lost her son 2 years ago. The NICU staff, the NICU family, came together and supported Sue and her family in this horrible time of need, in this time of stress. And we realized that that's what the NICU family does. The NICU family supports our families in the NICU. So we came up with this fund, it had its 1-year anniversary, and this fund is used to help families in need to buy car seats. We've bought specialized formulas, cribs, whatever the families need to help them through their NICU stay to make things less stressful and to ease that transition home. So we have a wonderful program.
And just
you.
to add to this a little bit, this fund has helped so many families. And one more thing that we've done for families is we help them be able to visit. A lot of our parents rely on the public transit system, a bus, a train, another bus to get to Silver Spring or to Germantown. And it's been such a gift to be able to say, hey, here's an Uber gift card. We would like for you to be able to visit, bond, breastfeed, pump at the bedside. We provide a lot of help. We want the moms to be here and the parents.
That's actually, again, a great way that the babies stay in touch with the families, et cetera. And I believe you have a NICU camera system in the NICU. Can you talk a little bit about that?
Yes, Nancy. Yes, we do. It's also another great gift for the parents. We have cameras that we put on top of the incubators or on top of the little cribs where the babies are. And the parents they get login information from the NICU, and once they log in, they are able to see on their cell phones or on their computer, look at their baby while the baby's sleeping, whatever the baby's doing. Oh, look, the baby's eyes are open. Parents love that. And this was also donated to us through a grant. So we're very thankful for that.
And then when infants get ready to go home, Dr. G, how does Holy Cross help with that transition?
Yeah, that is a big transition. And for a lot of families, it can be stressful. Having spent, like Dr. Heino said, weeks to months in the NICU, and now we say, okay, your baby's ready to go home. We have a whole team that works with families to prepare them for home. So we start with our nursing staff that encourages the moms and the dads to be hands-on with their baby, even from a very early gestation. Diaper changes, temperature checks. Moms initially, or parents I should say, initially are intimidated because the babies are so small. They gradually learn, they get more comfortable. By the time they're ready to go home, they can take care of their baby. We also have social workers that are staffed in the unit all the time. So parents have needs with emotional needs. Some of our moms have postnatal depression. The social workers help support them, make sure they get services that they need if they need some services after the baby's born. We have case managers that help them navigate the insurance system and make sure that the babies are registered with the parents' insurance soon after the babies are born. We have the physicians that talk to the parents every single day. We want to make sure the parents are up to date, they're not scared, they know what we're thinking, they know what we're doing, they know our plan of care.
That's very helpful, and just answering the question I know many parents have about what is the length of stay and determining when a premature baby can go home. Thank you. Dr. Heino, how about any special medical care for premature babies after discharge?
So after discharge, there'll of course be follow-up with their pediatrician. We also arrange all the follow-up for specialists that the babies might need. Some of our premature babies have to go home on home monitors. Some of the premature babies actually go home on home oxygen. So they have to follow up with the lung doctor. Some babies might have an issue with their heart. They follow up with the heart doctor or cardiologist. They have issues perhaps or need to be followed closely by an ophthalmologist. And we arrange all of those follow-ups for the parents. We ask the parents to bond with their pediatrician, make that appointment, and then we make all the follow-up appointments for them.
That raises an excellent point. It is important, is it not, for all parents to have a pediatrician and have follow-up care after they go home?
Absolutely. So starting a couple of weeks prior to discharge, we start talking to parents about, do you have a car seat? We'll have to have a car seat test for the baby. Do you have a pediatrician? If you don't know pediatricians, we can give you a list of area pediatricians to choose from. We ask parents and maybe they can interview different pediatricians to find a good fit for themselves, and then we get them their pediatrician at least a week or so prior to discharge. Yes, very important.
And still staying focused on the topic of discharge, Dr. G, I understand that there's a rooming in room for parents that may need to spend more time with their baby prior to discharge?
Yes, thank you so much, Nancy, for bringing that up. This is also excellent in helping the parents transition to taking the baby home. We have a room that's right outside our NICU, and we invite parents right before the baby is ready to go home, whether it is with equipment or not, but mostly for the families that do take home the tiniest babies that go home on equipment, with equipment. We invite them to spend either a daytime shift or a nighttime shift, taking care of their baby on their own, on their home monitor, if that's what the discharge plan is, to ensure that they're comfortable with the baby's care, they're comfortable with the equipment is working appropriately, and if there are any problems, the NICU is just outside, so they ring a bell, the nurse shows up. So it's very, very reassuring for the parents to have that option.
How about any long-term effects from a premature birth? Are there any?
Yes, definitely. A premature baby is going to have a lot of specialized appointments because exactly we worry about any potential problems. The tiniest babies can potentially have problems with their vision, so we make sure that they have appointments with the eye doctor, the ophthalmologist. They can have some problems until their lungs fully mature, so some of them do go home on a monitor and oxygen. And we make sure that we stay on top of them in terms of developmental follow-up. Developmental follow-up is really important. And the counties provide amazing programs for the families so that no baby falls behind. Instead of trying to catch up a baby after they've fallen behind, they try to make sure that a baby's development is on schedule, and if not, they will provide physical therapy, occupational therapy, speech therapy, whatever the baby needs. In those programs, infants and toddlers, parents love them. They do a really good job to help the premature babies.
And back to Dr. Hino, I know that Holy Cross's neonatal unit also cares for full-term babies that sometimes need a little extra support. Can you talk about that? And I believe it's whole body cooling.
Yes, so there are many reasons a baby might have to come into our NICU who is full term. It could be something as simple as their blood sugar is a little low. Maybe mom had diabetes or gestational diabetes. Maybe the baby's just a little small and that they have issues with their sugar. It might be stay with us for a few hours or a couple of days. Sometimes during delivery, the baby might have some issues. We might be concerned that the baby didn't get an adequate amount of oxygen during the delivery, and so we can have something called whole body cooling. That is a process that we use that can prevent further issues with brain development and with issues that we might see early in their NICU stay, such as seizures. So as soon as a baby comes in, they get identified as being needing whole body cooling, they get immediately placed into our program.
Thank you. And I know that today's conversation has focused so far on preterm birth. Just want to share that Holy Cross Hospital and Holy Cross Germantown Hospital also offer highly sophisticated maternity care to thousands of women in this region. In fact, last year, more than 10,000 babies were born at Holy Cross Health's 2 hospitals. That's more than in Maryland than any other health system. So a question again for Dr. Hino. What other services are available at Holy Cross Health? A perinatal diagnostic center, a Never Alone program. Can you speak to that?
Yes. So we have a diagnostic center here for to identify issues that might occur during pregnancy. We have a high-risk pregnancy unit that is right outside of the NICU, where mothers might be admitted while they're pregnant. They might stay here until they deliver. They might stay here for a few days while their diagnostic process is going on and then be discharged. They might come in a couple of times during their pregnancy and stay on our high-risk pregnancy unit. We also have a program here that is unique to Holy Cross called the Never Alone program. There are times during the pregnancy when it becomes apparent that the baby has an issue that they will not survive. And so the obstetrician will call us and we will set up a consult with the parents. We will put them in our Never Alone program. We sit down with them before the baby is born. We discuss what will happen at the birth, what will happen after the birth. Sometimes babies have issues. They won't survive for more than a few hours. Some babies survive for a few days. Some babies survive to going home, and we will help them set up home hospice. But this Never Alone program means that once we identify this issue, your support from us happens from the moment we find out to the moment you go home, to the moment the baby passes away. And this program is called Never Alone because your support from us means that you will never be alone.
Thank you, Dr. Hino. And Dr. G, is there support available for breastfeeding mothers?
Oh, yes, yes. We have a full service of lactation consultants, and they are in the NICU in the daytime, in the evening time. They're in the mother-baby unit. They do an amazing job of supporting breastfeeding mothers. But in addition, a lot of our moms that deliver premature babies, they don't know that they can actually eventually breastfeed. So we ask them to start pumping right after the babies are born. So our lactation support consultants, they start working with these mothers after they have a premature baby so that they can be successful in pumping, providing breast milk for the baby, which is really important, and then eventually transitioning to breastfeeding the babies.
And Dr. G, how about interpretation services if English isn't your primary language?
Yes, that is also important to know. We do have a full-time Spanish interpreter. Spanish is the most commonly used language, if it's not English, in our unit. And that's true for both Silver Spring and Germantown Hospital. So we have interpreters that are available to help with Spanish interpretation. And then if a family, which happens frequently and almost daily, when a family speaks a language other than Spanish, we do have a service that is available by video or by phone in a myriad of different languages. Hundreds of different languages are available, and we manage to connect with families in their native language.
Thank you. And Dr. Hino, I'm so glad that you brought up the Basile Fund to support families in need. We know that we have mothers out there that need prenatal care and oftentimes do not have access to it. Does Holy Cross Health offer any clinics to help them?
Yes, Holy Cross supports the community in Montgomery County. We have a prenatal clinic right here in the hospital, and many of our patients who come through Holy Cross, who deliver at Holy Cross, have been members of our clinic here at Holy Cross.
Thank you. Before we turn it over to see if there's any questions from the audience, anything else, doctors, that you want to share? I know that there's a special wall of photos in the NICU.
Absolutely. You know, Nancy, we have the best job in the world. We have parents that stay in touch with us for years, for decades. And that wall of photos, when you walk into our unit, really uplifts everyone who walks in. We have pictures of toddlers. We have pictures of school-age children. We have pictures of young adults in their cap and gown from high school, from college. We have people who come in and visit us before COVID, of course. We have people who come in and visit, and we just love watching these babies come from small premature babies, come through our unit, and then flourish as children and young adults.
And Dr. G, I know that there used to be reunions pre-COVID.
Yes, Nancy, we're hoping to get back to those. Hopefully soon. That is one of our favorite parts, to see those babies and their families come back, walking, toddling around, running around in their little cute outfits. We love that. And I just want to echo what Dr. Heino said. We have the best job. We love what we do. We love our babies. We love their families. And we're so proud of all the progress they make.
Thank you. I will also add that a special place for me, in addition to the photo wall, is the bench that the NICU staff, the NICU team, because it is a team, bought for the Basile family. That's a very special place outside the chapel. So I do have one question. Someone mentioned that their daughter was born at 29 weeks gestation. She is now 23 years old and received care in our NICU. So a testament to both of you, and the entire team.
Yes,
I do recall.
I was here 23 years ago, so maybe I took care of her.
Oh, congratulations. That's sweet.
Before we close, any other comments from either of our doctors?
I just want to say that we are available to the community at any time. If you have been told by your obstetrician that you have a high-risk pregnancy and you're concerned about where to deliver, please call us. We will talk to you about our services here again. We will talk to your obstetrician about the issue that you're having. We will talk about when you might deliver. And sometimes, really, the fear of the unknown is what causes the most stress. And so we have been through this thousands and thousands of times for 25 years. For me, for 20 years for Dr. G. So we have seen many, many premature babies. So if you have any questions, please just call us in the NICU. One of the neonatologists will be more than happy to talk to you.
Thank you. And Dr. G, anything to add to that?
Yes, no, I absolutely agree. We love what we do. We love the families. We're here for you. We're here to take care of you. So please let us know with questions and always follow up with us. If you've left our NICU and your baby is making progress, show us the progress, show us the photos, come and visit us.
And I echo that on behalf of the Women and Children's service line. We are here to care for our community and share your enthusiasm and love for doing what we all do. And I'm also noticing that we're about out of time, so I want to thank everyone for tuning in today. And if we did not get to your question or you think of one, we do plan to provide additional information through Holy Cross Health's blog. Or we can connect you one-on-one, as Dr. Heino and Dr. G just said, either in person through calling our NICU or through one of our maternity services channels, phone and our website. So if you want to connect with us to learn more about our neonatal services, please visit holycrosshealth.org/NICU, or not dash, I mean /NICU. And you're also welcome to call me, Nancy Nagel, as well. So again, I thank our doctors so very much for all the information that they've shared today and just for their dedication to our NICU, our littlest babies. And I thank everyone for joining us on Facebook Live with Holy Cross Health. We hope to see you again soon.
Thank you, Nancy.
Thank you, Nancy.